Sepsis it usually starts out as an infection, a pneumonia or urinary tract infection, and it just grows and it gets out of control and gets into a patient's bloodstream. And that's when it causes some really major issues for patients. The reason that it's so important to get treated for sepsis so quickly is, like I said, research is showing us that the faster that people get treated with their antibiotics and their fluids, it really has a huge impact on their patient outcome. About 250,000 people a year die of sepsis. If a patient is septic, by looking at their vital signs, listening to what their story is in terms of what's been going on with them at home. In terms of vital signs, though, we look for heart rate greater than 90, temperature either high or low. It seems kind of weird and counterintuitive that this patient doesn't have a fever anymore, but it's just as important as a patient having a fever. We look at a patient's respiratory rate. Your body tries to compensate by breathing quickly, and sometimes patients get a little bit of confused. They get a new confusion, and especially in older people, even if they, we say like, oh, they're just old or whatever, but it's a different kind of, it's a new confusion, something that they don't normally have, and now all of a sudden, why is grandma so confused? So that can happen to patients too. Anybody is at risk for sepsis. Of course, patients that are older are at risk for sepsis, but even very healthy people are at risk for sepsis. Some of the recent patients that we've identified as sepsis patients have been less than 65 years old. So
we try to bring life-saving treatment to the patient with sepsis. Sepsis is time critical. So we try to get treatment early, notify the ED quickly so that we're able to transition from the pre-hospital setting into the emergency room.
Well, any person who arrives in the emergency room that is screened in or noticed to be septic would it's pretty much a medical emergency at that point. So they get kind of rushed back, and lots of people are in your room, lots of activity going on. You get a blood drawn and IVs started, antibiotics and fluids in really quickly. All of that stuff, research shows that as fast as we can get it in, that's what really impacts patient outcomes.
September is Sepsis Awareness Month. South Georgia Medical Center is participating through the Georgia Hospital Association in a collaborative project across the state to improve the recognition of the signs and symptoms of sepsis, to improve community awareness, and to improve the treatment of patients who may have those symptoms. South Georgia Medical Center staff is involved with developing protocols to treat those patients, and also with developing community outreach and education to inform the public about these important signs and symptoms